Hello, everyone. My name is Jose Caballero, and I am a senior health education specialist with Solano County. And today I'm here with Dr. Christine Wu. She is the Deputy Health Officer and Chief of Communicable Diseases for Solano County. And for today's weekly update, we're going to once again refer to the dashboard. I want to remind everyone that the dashboard is updated daily at 4:30. Hi, Dr. Wu, can you hear me?
Yes. Hi, Jose. Thank you for pulling that up. As of Wednesday, April 22nd, as you can see, there have been 186 confirmed cases of COVID-19 and 3 deaths. Of these, 21 are currently actively ill and 10 are currently hospitalized. You can see that we have tested over 2,500 county residents. And as an indicator of our hospital capacity, the availability of ICU beds and ventilators is currently good, meaning that there are more than 30% of these resources available for our county to use at this time. You can also see the breakdown of cases by city that's in the middle of that dashboard. Last week, since we offered the drive-through testing in Vallejo the past 3 weeks for symptomatic first responders, healthcare workers, and essential workers, you'll see that the majority of the cases are currently in from Vallejo at 76, Fairfield next at 47. For the most up-to-date data on the dashboard, you can go to our website at www.solanocounty.com/COVID-19 and click on the button for the dashboard to get the latest.
Awesome. So one question that we've gotten a lot is, what do these numbers actually mean? What can you tell us about that?
So if before I start with that, I do want to just thank everyone for continuing to do their part by staying at home, washing their hands frequently, and maintaining that 6-foot distancing as much as possible when they're out doing essential activities, because these efforts have really helped our county not see the spike in cases that we were concerned about, and really helped our healthcare system from becoming overwhelmed. And I don't know if you want to go back and share the screen again of the dashboard real quickly.
Yes.
Because I wanted to just point out that in the middle, that yellow graph shows the rise in cases that we have had. And if you are to look at that, it's not a spike. It is rising, but it's rising because we're doing more testing, mostly because we're doing more testing and we're understanding our situation a lot better in our community. And this is actually one of the things that that we're monitoring very closely. But as you know, staying at home and sheltering at home is not something that's sustainable in the long run. Everyone is being affected by that. Our livelihoods are being affected. And so Solano Public Health has been working to ensure that our community is ready for when the time comes to loosen the stay-at-home orders. One of the governor's first criteria is with testing. And in the past 3 weeks, as I said, we've been doing a lot of drive-through testing in various communities, and that first 3 weeks was in Vallejo. This week, starting today, we are now offering the drive-through testing here in Fairfield, where the Public Health Department is located. We are actually expanding the testing to certain high-risk groups that are symptomatic. So people who have symptoms of fever, cough, chills, body aches, flu-like symptoms are eligible to be tested if they are 65 and up, or if they are any age who have a chronic health condition that puts them at higher risk. And so that would be some people who have heart disease, kidney disease, any chronic health condition, diabetes, lung diseases like asthma, COPD, emphysema, or if they, especially if they're actively smokers, and anyone who have an immunocompromising condition, those will qualify for, coming to be tested at our drive-through site. We're also continuing to test any symptomatic first responder, healthcare worker, and essential worker who live or work in Solano County.
Okay, so while we're not testing everybody out in the community, we are testing very broad groups of people that we want to make sure that we're protecting, right?
Exactly. And the key point there is that they do have to have symptoms. We unfortunately we still cannot, we have to prioritize our testing and cannot test those who are not symptomatic right now.
Okay. And I want to remind everyone, first off, that in order to make an appointment, you call the number 707-784-8655. And if you're not able to reach us during normal business hours, you are more than welcome to leave us a message. And I also want to remind everyone that testing is free. If you come to our drive-through testing site, there is no fee associated with that.
That's great. Thank you.
So now, can we focus a little more on children? I know that a lot of people have been calling us and just asking with regards to face mask, what can they do when they have young children at home and they want to bring them to the store or go out and do essential activities?
Yeah, so the past several weeks we have been talking a lot about face coverings and face masks, the differences between them, how to make one last week. And we, as of today, several of our neighboring counties have issued health orders that make face coverings in public mandatory, um, especially in places where it's difficult to maintain that 6 foot distancing. Well, so Solano County does strongly support this recommendation. And so we do urge you to follow those guidelines of wearing the face coverings when you're in public settings, when it's difficult to maintain that 6 foot distancing, particularly when you're indoors. However, you don't need to wear a face covering if you're alone indoors with those who you live with, or if you're out by yourself taking a walk. There are other guidelines that we will post on our website, so that you have that information as well, even though we aren't necessarily putting this as a health order. However, for today's health tips, I do want to focus on children, especially young children. Those we do recommend that children under 2 not wear a face mask, because this could be a suffocation risk. And under 12, actually, if it's difficult for children to keep the face mask on, it's probably safer for them not to wear the mask.
Okay. So if someone is going out with their child in the street and their child is not wearing a mask, they're not going to get fined for this, right?
No, and that was one of the other reasons why we're not making this a health order. We believe that we need to help the community, and our community has been doing such a great job of, just doing things because they know it's the right thing to do, and not doing things because they think they're going to be fined for it.
Okay. And what recommendations can you give us for people who are expecting children but don't yet have them? People who are
So
pregnant.
that's a great, I know we have been getting a lot of questions about that. So one mom who was asking because she was breastfeeding, we still, in public health, we think that breast milk is best, and so we still want to promote breastfeeding. However, if you're sick, if the mom is sick, it's important that you don't transmit any sort of illness, regardless of whether or not it's COVID-19, to your baby. And so if you're sick, wear a mask. And if you're able to pump the breast milk out and put it in a bottle for somebody else to feed the baby with, that's probably the safer way to feed the baby. But I know that a huge part of breastfeeding is that bonding moment, and so we don't want to take that away from the parents.
Okay, cool. Thank you for that. And what about, I know we're talking a lot about children today, and as people have been at home for a long time, a lot of the calls that we're getting are with regards to children, being stressed out and acting out.
Yeah,
What
especially, well, like children are, I think of them as like sponges. They pick up on your stress, on the stress of this, what's in the room, right? And so sometimes that causes them to be stressed out too. Children, especially adolescents and teens, they can express stress in a variety of ways, from acting out to the complete opposite of, just withdrawing and not even wanting to participate. The first thing I would say is really keep your calm, control your own anxiety. And you can do this however you normally do, either, maybe through exercise. That's always a great stress releaser. And you can still go out, even with the shelter at home orders, to get exercise outdoors, get some sun. Meditation's always great. But basically, you want to present an outward calm for your children. And modeling this behavior helps the kids know how to behave too. Additionally, great ways for modeling it includes, for especially for young children, if you're washing your hands, you're showing them how to wash their hands effectively. You can sing happy birthday song twice with them because that comes out to be about 20 seconds. And then for and then the most important thing though really is to talk to your children, because we can't just assume that they know what we know what's going on in their heads. And so one great question to ask is, what do you know about coronavirus, and start there and see where that goes, because that helping them understand the situation is always a great thing to do. And I think, if parents are feeling stressed and need help, our mental health behavioral line is available, and we'll post that number with this video.
Yes. And we also, for those people who don't know how to talk to their children about coronavirus, we have a PDF book that was given to us in many different languages, and we also have that on our Facebook group. So if you don't know how to talk to your child about coronavirus, one simple way is also going to be on our Facebook. So feel free to go out and do that. And the last thing I want to talk about today is about bleach. We know that bleach is one thing that is helping us a lot with fighting against coronavirus, and we also know that it is very harmful for children. What can you tell us about that?
So we've been hearing a lot about we've been hearing a lot from the Poison Control Center that there's been a spike in poisonings related to bleach, especially bleach fumes, and that's because we have children at home now, and a lot of times, I tell my kids to do this, to help me clean up, and and they have their chores to do. And so for the older children who are helping around the house, we need to be sure that we're teaching them how to clean safely. And bleach should never be mixed with anything other than water. Many common household cleaners, such as window cleaners, contain ammonia. Toilet bowl cleaners, they contain ammonia, and if you accidentally mix bleach with ammonia, it actually creates a toxic fumes. And so, we just want to make sure that it's okay and it's great. We want you to keep up with the, increased hygiene and cleaning, but just do it safely, especially with kids around.
Okay. And we're also going to link our poison control number on this video, so that if anyone does end up having difficulties or they want to share out the video, please feel free to do that. Well, I think those were all the questions I had for today. Thank you so much again, Dr. Wu, for joining us with these weekly updates. We really appreciate it.
Thank you.